HD is a bright and active 3-year-old boy. He recently developed symptoms of a common cold. His parents noticed he had a cough, runny nose, and a mild fever. However, their concern grew when they felt a small, swollen area on the side of his neck. The swelling didn't seem to bother HD initially, but as the days passed, the swelling increased in size and HD started to become fussier than usual. Concerned, his parents took him to see their pediatrician. The pediatrician examined HD thoroughly. They confirmed the presence of an upper respiratory infection, likely a common cold. The doctor explained that the neck swelling was likely lymphadenitis. Lymphadenitis is the medical term for swollen lymph nodes. Lymph nodes are small, bean-shaped glands that are part of the body's immune system. They often swell in response to infections. The pediatrician prescribed antibiotics to treat the infection and advised HD's parents to monitor the swelling closely. They reassured the parents that in most cases swollen lymph nodes would resolve on their own with treatment of the underlying infection. Neck masses in children are common. They can be caused by a variety of factors, ranging from harmless and temporary to more serious conditions requiring further investigation. Understanding the potential causes of neck masses is essential for healthcare providers to make an accurate diagnosis and develop an appropriate treatment plan. In children, the most common causes of neck masses are reactive lymph nodes. These are enlarged lymph nodes that are responding to an infection like a cold or ear infection. Lymph nodes are like the body's little soldiers fighting off infections. Other common causes include viral and bacterial infections such as infectious mononucleosis or cat scratch disease. Less commonly, neck masses can be caused by congenital abnormalities, meaning they are present at birth. These could include things like thyroglossal duct cysts or branchial cleft cysts. These are benign growths that typically don't cause any problems but may require monitoring or surgical removal. While rare, neck masses in children can also be a sign of more serious conditions. These include malignancies like lymphoma or rhabdomyosarcoma. These are cancers that require prompt diagnosis and treatment. To better understand the nature of HD's neck swelling, the pediatrician would ask his parents a series of questions about his medical history. When did the swelling first appear? The onset and duration of the swelling can provide clues about its cause. For example, a sudden onset might suggest an acute infection, while a gradually enlarging mass over weeks or months might point to a different underlying condition. Has HD had any recent illnesses such as fever, sore throat, earache, or cough? This information helps to identify potential infections that could be causing the swollen lymph nodes. Knowing the specific symptoms can help narrow down the possible causes. Has HD been exposed to anyone with similar symptoms or any known infections like strep throat or mononucleosis? Exposure to contagious illnesses can increase the likelihood of certain infections. Has HD traveled recently or been in contact with any animals? Travel to certain regions or contact with animals can expose individuals to unusual infections that might not be common in their local area. Does HD have any allergies? Allergies can sometimes cause lymph node swelling. Has HD received any vaccinations recently? Vaccines work by triggering the immune system, which can sometimes lead to temporary lymph node swelling near the injection site. Does HD have any history of chronic illnesses or immune deficiencies? Children with weakened immune systems may be more susceptible to infections or other conditions that can cause lymph node swelling. Section 4. A possible connection: respiratory infection and the neck mass. HD's recent upper respiratory infection could be directly related to his neck mass. The timing of the swelling coinciding with his cold symptoms suggests a reactive lymphadenitis. When a child gets a viral or bacterial infection, like a cold, their immune system kicks into gear. Lymph nodes, being part of this immune system, trap and fight off the invading germs. This can cause them to become enlarged and tender. The location of HD's neck mass is also consistent with an upper respiratory infection. Lymph nodes in the neck, particularly those under the jaw and behind the ears, are commonly involved in upper respiratory infections. These lymph nodes are responsible for draining fluid and fighting infections in the head and neck region. While the respiratory infection is a likely culprit, other possibilities must be considered. It's essential to rule out other causes of neck masses, especially if the swelling doesn't improve with treatment or if HD develops any other concerning symptoms. Section 5. Looking deeper: blood tests to uncover the cause. To gain further insight into HD's condition, the pediatrician would likely order a series of blood tests. These tests analyze different components of the blood and can provide valuable clues about the underlying cause of the neck mass, complete blood count or CBC. This common blood test measures the different types of cells in the blood, including red blood cells, white blood cells, and platelets. Elevations in white blood cell count can indicate infection, while abnormalities in other cell lines might suggest other conditions. Erythrocyte sedimentation rate, or ESR, and C-reactive protein, or CRP. These are markers of inflammation in the body. Elevated levels suggest an active inflammatory or infectious process. Asterisk monospot test. This test checks for the presence of infectious mononucleosis, a viral infection that can cause fever, sore throat, and swollen lymph nodes. Asterisk antibody tests. Specific antibody tests can be ordered to check for exposure to certain infections such as Epstein-Barr virus, cytomegalovirus, or cat scratch disease. The results of these blood tests will help the pediatrician narrow down the potential causes of HD's neck mass. For example, if the blood tests show elevated white blood cell count and positive antibody tests for a specific infection, it would strengthen the suspicion of an infectious cause.